go ahead and call our November meeting into session. First on the agenda, members, is approval of the minutes. Do I have a motion? Excuse me. Let's go back to roll call, please. Madam Secretary, roll call.
Preble Acton, Rhonda Allen, Andrea Anthony, Doug Bodery, Amber Brown, Shay Crowell, Holly Deering, Alan Farley, Mary Hickerson, Lois Miller, Alan McAdoo, Jeff Phillips, Shante Sherrill, Eric Tutobeni, Mayor Ketron.
Here. We have a quorum. So next on the agenda is approval of the minutes for the October meeting. I'll entertain a motion. Have a motion to approve and a second. Any discussion? Miss Allen, let the record reflect Miss Allen's here. She's present. Any? Second. Any further discussion? Seeing none, all in favor of approving the October minutes from that meeting, signify by saying aye. All opposed, motion carries. Next, members, we have the financials. Mr. Elam, you're recognized.
Thank you, Chairman Ketron. On your first page, you have the graphs where you have the calendar year to date, numbers, our current revenue is at $63,400,173 compared to expenditures at $60,136,583. And if you want to look down below that at the fiscal year, you see that the revenue is at $17,628,694 and the expenditures at $25,515,894. Moving over to the tracker page, if you look on, you can look under the calendar year, the month of October 2019, the revenue was $7,074,950 and the expenditures was $5,493,141. Revenue less expenditures is $1,581,809. The difference for the year, the calendar year, is $3,263,591. And for the fiscal year, it's a negative $7,887,200. Any questions on the Fund 264? Okay, so we'll move on to Fund 266. And when you look at the graph, the first thing that stands out in that graph when you look at the month of October was 2018, and of course, you know, I went back and looked at that just to kind of get a review what happened. And in 2018, there was a workers' comp expenditure of $158,334, and the OJI itself was $24,000. So that's what your big spike is in the 2018. When you look at this year's year to date, on the next page, you have $141,080.27, and the year-to-date last year was $315,911.57. For the month of October, you had $26,377.88. The OJI part of that was $24,522.47. The workers' comp part of that, which is a lot less than what it was in 2018, is $1,855,041. Any questions on the 266 fund? Okay. That would conclude my report, Mr. Chairman.
All right. Thank you, Mr. Elam. Are there Chair will entertain a motion for acceptance of the financial statement by the director. I have a motion for approval and a second, Mr. Phillips. Any discussion or questions? All in favor, signify by saying aye. All opposed, motion carries. Next, we have the annual enrollment update. Ms. Griffey.
While she's coming up to the podium, Mr. Chairman, she's going to give you some statistics based on our annual enrollment for this past month of October to the 1st of November. And I'm very pleased with these numbers. Of course, you'd always want 100%, but compared to the years past, in a passive year, I think they've worked very hard to reach these numbers. So go ahead.
Yeah, before you do that, let me just step in here, and I want to personally congratulate you and your whole department, Mr. Elam, and everybody that was involved in our open enrollment. It was phenomenal this year. The numbers that you're fixing to give us are very, very impressive over our numbers last year. And what I was most impressed about, I didn't get any complaints. The mayor's office did not get one phone call complaining, because it's my understanding that because the commission had listened to the request of the director and got laptops for our members to do that were portable, and they started on it early. They attacked it. They had the job fair out at Lane Agra. You all went above and beyond, and even had your laptops up and going until 11 o'clock that night, and answered every question that people were trying to get answered, and no complaints. So that speaks a lot for the job well done. I just want to say congratulations.
Yes, Mayor Ketron, I think Thursday night, and annual enrollment closed on Friday at noon. I think there was 60 emails that were received from like 6 o'clock till about 10 that night. And all of those emails by the staff were answered. We do understand, especially with our teachers that work from 8 to 3:30, 4 o'clock, our hours is not always their hours, and it's a little bit difficult to try to conduct business during the same, when you're both working at the same hour. So we extended, with the laptops, we extended our hours basically by being able to communicate with them. That's just, I think that's one of the indications of what we see in these numbers.
Okay, Melissa.
Thank you, Mr. Ketron. I appreciate that.
You're welcome.
It takes a team to do it, that's
There
for
were
sure.
good chess squares today, too. Thank you. You made those, huh?
Thank you. I hope you got one to go.
I did. On the way back up.
Well, good afternoon, everyone. I am Melissa Griffey. I'm the Senior Benefits Analyst in the Insurance and Risk Management Department. What Mr. Elam asked me to do today is just give you a little bit of numbers of what volume and numbers and the way the plans went this year that our office saw. I just finished scrubbing the reports after open enrollment closed and was able to pull out these numbers last night actually and get them ready for the meeting today. So the first thing I want to tell you is most of you probably already know it was a passive enrollment, which meant that employees did not have to go in and change their benefit if they did not want to. There were certain things that never carry over from year to year, like a flexible spending account. So with it being a passive enrollment, what we saw out of 6,615 active eligible employees, we saw 4,564 that actually went in and accessed the benefit system this year and either enrolled in a plan, changed a plan, added a beneficiary, looked around, or did some kind of activity that the system recorded. That was up 17.72% from the prior year. So there was a lot more volume this year for sure. The numbers that we saw, the way that the plans migrated from one plan to another for 2020 compared to 2019, we had a 30% decrease, 30.48 actually percent decrease in the enrollments in the deductible plan. That is the plan that is grandfathered, and we do not allow any enrollments in that plan But the employees did have the option to opt out of that plan, or if they needed to change a tier, they could do that. But we dropped from 374 that were enrolled in that plan at the beginning of 2019. And the reports that I prepared last night, we have 260 enrolled as of January 1st. So this is a future report I prepared of who signed up for what for 2020. Of the HRA plan, we saw an increase of 5.93% in that plan. So our enrollments went from 2,919 to over 3,092. In the copay plan, we had 2,212 enrollments in the copay plan, and for 2020, we're expecting 2,307, an increase of 4.29%. Again, this number, the 5,659, that is active employees only. That it does not include our retiree population. Those employees do not have access to the benefits platform. Their open enrollment's handled a little differently, so that's why you don't see those numbers included with the numbers that I'm reporting to you on the final count, the 5,659. So, any questions? Yes, ma'am.
With the retirees not included in here, do we have a level of comfort yet with if they were able to make any changes, or?
We had very little activity. We this year we did the retirees open enrollment coinciding with the active employees. There was very little movement. I have not gotten to those reports yet, but just going on memory of the activity I saw in the office, there wasn't a lot of movement, which is typical. That most of the time when a retiree gets into a plan, they stay there until they're moved to the Medicare plan if they're pre-65, or they drop the plan at 65 and take a Medicare supplement somewhere else.
The reason I'm asking is I remember that when we had first talked about open enrollment and the deductible plan, which was clearly in insurance lingo in a death spiral, that if it dropped below a certain level, that we would need to remove that plan from the inventory, so to speak, and replace it with something different. And with it down to around, where did I see the total numbers, 260, I think that's probably likely to happen. But do you recall off the top of your head how many retirees are?
We have, in pre-65s, we have roughly 150. I do not remember the number of those that are enrolled in the deductible plan. I know it is lower than the copay, of course, but I do not remember right offhand. My suspicion when I run those reports today is probably it's going to get us close to being under 300, maybe a little over. I expect to see that, but again, I don't know those numbers right offhand, and I haven't run that data yet. But we did see a significant drop in the active population. You're welcome. Thank you.
Thank you, Lois. Other questions? Okay. Thank you, Ms. Griffey. Dan, come on down. Next we have members. We have the workers' comp and OGI stats and OSHA report. Mr. Dan Good, you're recognized.
Good afternoon. I'd like to report in the month of October that we had 21 injury on county employees requiring medical attention. That brings the year-to-date total to 224 injuries. Of those, 153 of them are OSHA recordables. 74 had restricted days where employees had restricted duty, couldn't come back to their full duty. 29 for the year-to-date have been lost time injuries, and then 50 all others. If you look at the next page of your report, you'll see how we compare this year to the two previous years. This year, the 219 compared to the same time last year, 227, and compared to 2 years ago, 187. Just remember, we've also added a number of employees to the county roles in the last 2 years. Also, we opened up 2 new schools this year. If you look at the next page, try to judge the severity of the injury by the incurred dollars. The incurred dollars for this year to date is $415, and if you look at last year this time, it was $525,000. and compared to 469,000 compared to the 415 this year. You notice last couple years we've had a couple severe injuries that caused the spikes that you see, and we've been very fortunate this year that we've not had any of those injuries. On the last page of your report, just want to review where those injuries occurred. 11 of them were with the Board of Education. The County General had 9, and the Highway Department had 1 injury. And lastly, just underneath that graph there, we have the County General. You'll notice that those 9 involved the Sheriff Department, Juvenile Detention Center, and Animal Control Paws. Any questions?
Any questions, comments? Ms. Allen?
We had 2 miscellaneous. What would a miscellaneous be on the types of injuries, the cause of injury? On the report, you've got 2 listed as miscellaneous. I'm just curious what a miscellaneous would be, an example.
Sometimes we have several that where just don't fit into a normal thing, where a person may have, I'm trying to think what miscellaneous would be. They just don't fit into the normal slip, trips, and falls, the strains and things like that. I can't think of one right now off of that, but it just doesn't fit into the normal category.
Chemical,
I'm sorry, pardon?
any exposure to a chemical or something
Well,
like
possibly bloodborne pathogen. Yes, that would be one. We don't have a category for bloodborne pathogen. That may be where somebody, if you know, either an inmate or somebody has a confrontation, or somebody comes into one of the offices and there's an exchange of bodily fluids or something like that, then of course that doesn't have a kind of. Thank you.
Was one of those a bee sting?
And we did have a big sting. Yes.
In one of those 2, a bee sting?
Yes, you're
Okay.
right. Actually, I think it was bee or wasp sting. I'm sorry, I forgot about that one. Thank you. We had a discussion on that one, didn't we?
They were allergic, so they had to
Yes.
go to the hospital, so, or emergency room, whatever.
Bee stings and snake bites fall into miscellaneous.
Oh, no, none of those yet. Thank you.
All right, any other questions? I have a motion to approve the report. Is there a second? And a second. Mr. Farley in the back. All in favor of the motion, signify by saying aye. All opposed, motion carries. Thank you, Dan.
Thank you very much, sir.
Mr. Chapa, wellness update. Wellness coordinator with Cigna.
Hello, everyone. So the Motivate Me system is still slowly trickling in claims from September 30th. Some of them take a little while to get through. That said, though, it has slowed down. Once we conclude, it'll probably be about the 2nd week of December. We'll start severely scrubbing that list to make sure everyone that possibly completed these gets credit for it, and then we'll start the appeals process. And for those that are not familiar with that, we'll take those individuals that did not meet their 3 points or their incentive requirement, and we will mail a letter to their home based on the address on file with the Benefits Department, notifying them that they have until January 15th to provide documentation showing that they completed, whatever particular piece of the incentive portion that they feel they have completed. So that documentation, you have that entire period over the break as well into the 2nd week of January to provide that documentation. We'll review it. Once that's reviewed, then that will go to the Benefits Department for the incentive dissemination. That said, the report for November, the numbers continuing, like I said, to trickle through, but we're sitting at about 2,039 annual physicals, 4,051 biometric screenings, 2,917 health assessments, 980 mammograms, 1,649 OBGYN screenings, 337 colon cancer screens, 1,401 cervical cancer screens, 394 prostate exam screenings, and 2,320 flu shots, To date, currently, we're sitting at about 5,124 individuals that have met their entire incentive requirements out of an eligible population of 6,440 as of the 18th. So we're at or about 80% right now. Once we scrub those lists, again, I predict we'll rise from there quite a bit as well. So with that, I think last month we were sitting at about 76%, so we continue to see a little trickle upwards from there. That said, just some upcoming events and some things that are available for the remainder of 2019. The Life Services EAP online, on-demand webinar will be on multi-generational caregiving, and that's available, or was available as of November 19th. And then the one for December will be available on December 17th, and that involves examining relationships. And that concludes my report for November.
Any questions? Thank you so much for the update.
Very much.
Thank you. Lee Smith. Time that everybody likes. Did you know?
Good afternoon, everyone. I'm here today, again, to talk about Cigna programs that we have that are available to any of the members that are on the medical plan with Cigna. Today I'm talking about chronic condition coaching. There's a flyer in your package, so feel free to go back and share that with your employees. Our chronic condition coaching program, so if we have a member that's living with a chronic condition, say back pain, depression, arthritis, asthma, maybe cardiac disease, we have programs that are available where in addition to seeing your physician, you will also have the opportunity to work with a Cigna health coach who will work with you to establish and reach the goals that you set for yourself and just overall better health. With this one-on-one relationship with your coach, you get help managing your health condition and making more informed decisions to create a plan to improve your health based on your personal goals. You can also focus on coping with stress, maybe tobacco cessation program, maintaining good eating habits, or managing or losing weight. The combination of knowledge and support can make a healthy difference. Programs that help manage chronic conditions can be an effective way to help you better manage your health and have more time and energy for life and the things that you enjoy. So to reach a chronic condition coaching or to instruct your staff members how to reach a coach, they can go to call the number on the back of their ID card, or they can go to mycigna.com and actually reach a coach that way as well. Any questions on chronic condition coaching? Nope.
Thank you, Lee.
Time.
Yes, ma'am. Thank you. Next, we have Shannon McNair, MedPoint report. Premise Health. You're welcome.
Good afternoon, everyone. If you'll open the PowerPoint presentation that's in front of you for MedPoint for the month of October, you'll see 1,319 total clinic visits, and that's 831 provider visits, 409 medical assistant visits. That includes lab-only injections. We had 5 biometrics, so people are already trying to get their incentive points for 2020. We had 5 occupational health visits and 69 wellness visits. I did want to point out with those wellness visits, we did, as I mentioned last month, do the mobile here at the risk management office down the street here, and we did it again this month, and our team went out to local offices and delivered our flyer to continue to bring people in, and so that was also successful this month, and we'll continue that moving forward with the help of Mr. Elam.
And Ms. Stevenson.
And Ms. Stevenson. She drums up. Kudos to Ms. Stevenson. Absolutely. Non-face-to-face encounters, we had 1,261. That's 202 orders only, 375 communication encounters, whether it be through the telephone with a provider or portal communication, and then 684 results review with letter communication. So that's where the providers are reviewing lab results and sending out communication to the patient regarding those results. Excuse me. On the next slide there, you see our flu shot summary. I just wanted to point out 2018, we did not offer any of the flu shots in the clinic before the health fair. So the first time getting a flu shot was at the health fair for 2018. And we gave 231 flu shots given at the health fair in 2018. This year, we offered them in the clinic because they did ship in a little earlier than normal this year. So we started offering them in September, on September 7th. Prior to the health fair and the flu clinic, we gave 619 flu shots between September 7th and October 18th in the clinics. You know, I do want to point out here, we had a lot of people that say, I normally don't get the flu shot, but it's going to get me an incentive point, and they went ahead and got the flu shot. And so I think, you know, they had an ulterior motive, but it's an added health benefit that they got that flu shot. So we had a great turnout in the clinic with those flu shots. And then at the health fair, we even saw an increase over 2018, and we gave 243 flu shots given at the health fair, in addition to the 619 in the clinic. We still have flu shots available in the clinic, so if anybody asks, please let them know that they can come in and get a flu shot. We do walk-ins at Stewart's Creek, and we have appointments at Blackman and Walter Hill for the flu shots still. All three clinics still have them available. My next slide, did you know? So did you know that MedPoint can carry out community provider orders for $0 copay? So it's an added service that we have there at the clinics. You need to have a written order from the community provider, and it can include lab work. So if you get regular monthly lab work done and you go to your community provider, they may charge you a copay or an HRA to complete that. If you bring the order from the physician, we can complete those for you. Labs specifically, they go directly back to the physician who ordered the lab. So we don't get those results back. They go directly to your community provider. Another service that we provide is injections. So testosterone injections, you know, that can be weekly or bi-weekly, and that can get expensive with copays and deductibles. So if we have the order from the physician and we have all the information, we can get you started at those in the clinic at no copay. If you have anyone who's interested in a service, if we can provide the community provider order service for them, please have them give us a call, or they can email us at the email listed there, and we can answer the questions for them to let them know if we can carry out the order. We'll turn 2 pages over. We have our month-to-month trends, and that's just the graph showing our clinic visits and our non-face-to-face encounters. You know, you see the spike in September related to the biometrics, the increased physicals related to the incentive program, and then we're at 1319 for October for the clinic visits. Any questions so far? Nope. On slide 7, we've got our summary there. So for October 2019, we had a total unique member count of 1,060 unique members that came into the clinics. We had a total operating cost of $248,858. The employee count, including retirees, for last month was 6,211, putting us at a per employee per month at $40. Any questions? The last slide then is just on our incoming calls at MedPoint. October 2019, 1,457 incoming calls with an incoming call average per day at 63. And that concludes my report. If anyone has any questions.
Any questions for Shannon? Thank you very much, Shannon. Next, we have Yvonne Smith, Life Services EAP. Did you know?
Mayor Ketron, just to say, before she gets up, in all fairness to her, we received this report last night, and I think Commissioner Phillips asked for a report. So the numbers here are very fresh, just got those, but I didn't want it to go another month. I wanted to be able to get the information out to you, and so you can digest the report yourselves. But it does give you that utilization that they have. And I don't know if y'all have seen this report before, but just trying to get it out there for you and trying to, you know, get what I think. You can take a look at this, Commissioner Phillips, if this is what you like, then, you know, and we can condense this down, but this hasn't been tweaked or anything. We just made copies last night to get it to everybody.
Yeah, that's a good point, Mr. Elam. Just, y'all take a look at it. If there's information you don't want, we can retweak it and give you whatever the committee desires. Okay, go ahead.
All right, hello. My name's Yvonne Smith with your Life Services EAP, Employee Assistance Program. And a couple things I'm just going to go over for this month's Did You Know? The video online counseling session service that's available. So it's like it sounds. Instead of coming in the office, someone can actually have their counseling session via their computer. Let me tell you a little bit about that, the way it works. They have to have a secure computer where there's some privacy, so they wouldn't want to do it in the middle of Starbucks. They have to have their speaker available, like on, their video camera on for it to be online. It's set up for adults, so it wouldn't be conducive to doing, say, family counseling or marital counseling online, and or therapy with children, which involves a lot of play therapy, or adolescents. So we did have this in mind for adults. So the way it works, if someone wants to have the online service, say like their schedule's busy, it's just hard for them to find the time to drive into our Murfreesboro office, then they could set this up by calling, like they would basically any other session. They call this 800 number and say, what I want to do, I'd like to set up the online counseling session. And they walk them through it. So they connect that person to the counselor, and then the counselor would tell them what the next step is. And what we use is GoToMeetings, which is HIPAA compliant. So that is pretty much how that works. Any questions about online counseling? How they would use it, how someone would use it, what it's for?
Is there a time limit?
Time limit in terms of how long does a session last?
Yes, ma'am.
It's standard, so 50 to 60 minutes is a standard therapy session. So that part would be the same, and would be the same in terms of how many sessions they get, which is 6, or you all get it, which is 6. So anything else about that? Online, right. Two things, it's the platform you use. That's why the information, we had basically some folks working on this, and they said that the one that we chose, the GoToMeetings, is HIPAA compliant. So that's probably the most important thing, but also talking to the person that we would be doing the counseling with ahead of time, make sure you're in a private setting. If you want to make sure what you talk about is private, then you don't want to do it in a public setting. Yes. Now I see what you mean. Yeah. Yeah, there are. That's a good question. Okay, anything else before I move on to utilization report? Okay. Like I said, this is kind of hot off the press, so the utilization reports are at least available to you. And what I thought I would do is just take a moment just to hit a few of the highlights. And in between now and when you all convene again for the January meeting, our owner-president, Danny Williamson, he'll be doing a more fleshed out, full-fledged, however much time you all have, presentation on this. But I thought since it's out and it's available, I would hit a couple highlights. Then the main ones being on the one that says EAP utilization report. If you go down, you'll see cases open. So I tallied that number. So cases open, which would be employees and family members, came out to 157. And then it gets into how did someone come to the EAP, and you'll see on there the majority would be they were self-referred and other, which doesn't tell you a whole lot, but sometimes that's what people check off. The other part I was going to point out is on page 2 of this EAP utilization report. It gets into how are they even aware of the EAP, the biggest number there being because they've used it before, the second being family suggested. And so I'm going to kind of go through this pretty quick. And on page 4, it gets into why do people come to the EAP for year-to-date. The number one reason, and that's what I've seen in my practice as the EAP counselor, emotional issues. The biggest I've seen an increase in the last, I'd say, 3 to 4 months would be anxiety. But emotional could be anxiety, depression, or a combination. Usually they go together. And then the second being family, and then the third being EAP legal. That one kind of surprised me. So a lot of people are calling, in other words, for that reason, because of wanting to use the services of their the legal area. And then lastly, total number on page 5 year to date that received, number of employees that received clinical services is 161. So that was the main things I was going to touch on that one. And then the other thing I wanted to point out is on this impact report here. Year-to-date total of employees, it's at the bottom left, utilizing the EAP is 439 employees. And clinical services would be 379. The difference would be that the total could include other things like work life and other services that's under the umbrella of the EAP. And then the last one I won't go over, but we do gather information anytime someone comes for the first time. It's called, we ask them work performance problems. And it gets into, are they given a verbal warning, written warning, any suspension, that sort of thing. So it captures all of that. And if you see NA, what that means is it's a family member. And so that doesn't apply because the work performance problems being asked about are only related to the actual employee. So that's all the reports. I know I kind of flew by that pretty quick. I'm going to be brave and ask any questions on that, on the report. No?
Alan?
In comparison, based off of a number of people who are available for this, what would you say is the utilization compared to maybe other organizations or companies this size? Are our people and their family members, are they utilizing it?
As a matter of fact, I was talking to Danny on the way down about that, and he's going to use examples of other counties in his presentation. But the national average is between 3 and 3.5% is the national average. Now, that's not just counties, but yeah. So you all are looking pretty good on that. Anything else? Okay. If you think of questions, feel free to call me, or like I said, we'll be back in January. Thank you so much for your time.
Thank you, Ms. Smith, for your report. Anything else to come before? Any other business come before us? Ms. Smith?
The question had to do with who is considered an employee.
Yeah, who is that 7,251?
So that would be the number that's reported to us in terms of how many employees are covered under Rutherford County. But you're probably wondering how that number is derived, maybe?
No, there's a lot. We've got employees who are not covered by our benefit plan.
Gotcha.
Employees covered under the EAP.
The best way I know to answer that, and I can get a better answer for you, is EAP is separate from insurance. So it wouldn't necessarily correlate with your insurance. Does that help at all?
I'm assuming the answer is yes.
Mr. Phillips?
Yes, ma'am.
If you don't mind, if the EAP is for any Rutherford County employee, full-time, part-time, and I just heard a bug in my ear, retirees are also, I didn't realize that, retirees are also eligible for this. So this is not only county general, highway department, BOE, every employee, full-time, part-time, the retirees also. So that's how that number's a little larger than what we see on our health insurance eligibles.
just thought of one other thing. Sonia, you can tell me if I'm on the right track with this. It's also open to any household member. We think we decided up to age 25, 26, something like that. So that's going to make the number
If
higher.
anybody's living in the household, so like my spouse, my child, if I had a family member, my son goes off to college and he's at college, he can actually call in because he is part of the household. But anybody living under the roof can also participate, and that's kind of hard to quantify that number. The 7,000 is really just the employee population, but it also extends to other people within the household.
Holly, do you have a question? Ms. Daring? Okay. All right, ditto. All right. Any other questions? Okay. That brings us to any other business to come before the... Yes, sir.
Third week.
Third week?
Third Thursday.
Third Thursday of December?
Sounds right. I don't. Third, yeah, if that's.
December 19th is
yeah,
correct.
That is correct.
Okay. Anything else to come before the committee for the good of the order? Chair will entertain a motion to adjourn. Have a motion and a second.
Mary.
All in favor of adjournment signify by saying aye. All opposed, motion carries, and happy Thanksgiving.